I want to talk for just a minute about hair transplantation. Hair transplantation is a fantastic part of my practice, very fun. I think one of the things that I love most about hair transplantation is that the hairline, the shape of the hairline, the position, the height of the hairline very much contributes to facial aesthetics. So it's part of the look of the face. And so I think understanding that and making sure that you have an appropriate frame to the face is almost sometimes as important as the other changes that you make to the face itself. So I think hair fits naturally into my specialty, into facial plastic surgery. Now, some of the basics, there are a couple different ways to do hair transplants. Number one, hair doesn't grow as single hairs. It grows as a little grouping or clumping of hairs. So I've kind of illustrated down here at the bottom a 1-hair graft, a 2-hair graft, a 3-hair graft, and a 4-hair graft. So if you look closely enough at hair, you'll see that it comes as this little grouping or clumping. There's what's called a sebaceous unit, which is an oil gland that grows around the follicular unit and secretes onto the hair. And then there's the erector pili muscle, which is a small muscle that contracts and causes goosebumps. So again, identifying and understanding that hair doesn't grow as individual hairs, but rather a small grouping of hair is very important with hair transplantation. Now, there's 2 different ways to transplant the hair. Number one, and kind of the older technique, is what's called follicular unit transplantation, also known as FUT, or the strip method. All mean the same thing. And essentially what happens with FUT is that a long strip of hair is removed from the back of the head. It's closed down on itself, so it leaves a fine linear scar that can be seen if somebody cuts their hair very short, but as long as they leave enough length to the hair, then the scar can't be seen. You then take that strip and sliver it into small pieces and then cut it down into the individual follicular units. And you don't want to divide those. So if it comes as a quadruple, you keep it as a quadruple. Comes as a triple, leave it as such. We separate the single hair grafts and the bigger hair grafts, the multiple hair grafts, into separate piles. And that's the first aspect of a hair transplant. Now, a newer technique of doing a hair transplant is to do what's called follicular unit extraction. And in this technique, a small punch is used to pull the hair out one at a time from the back of the head. Now, it's a very small punch. It's 0.8, 0.9, or 1 millimeter in diameter, so it's a very, very tiny punch. And then you go to the back of the head, you identify the follicular units, and you punch them out one at a time. This is a diagram of the punch coming in and covering a triple and taking out that triple graft. Now, with a strip, I talked a little bit about the scar that you leave in the back. And again, it's not a terrible scar. It's meant to hide well with just a little bit of length to the hair. But the benefit of the follicular unit extraction is that there's no visible scarring unless you basically bick it down to nothing. Just a tiny bit of length to hair covers it up well enough. And some people even shaved, like you can't see anything on the back of the head. So it's essentially a scarless way of doing a hair transplant by extracting those grafts individually instead of taking the piece out all as a single piece and cutting it up into the individual grafts. Now, in the end, whichever way you harvest, you take these grafts and you implant them into the front part of the scalp. The implantation in the front is the same, whether you're doing follicular unit extraction or follicular unit transplant. The technique used in the front, the growth patterns, how it ends up in the end is the same with either technique. It's the extraction method that differs.